Hi guys, Kane Harrison here. Welcome back to Nashville Health and Wellness Programming. We are once again joined by Michael Ramsey, who is Director of PAI Medical Group at WeGrowHair.com. I've gone from one extreme to the other, where I thought there was perhaps just one procedure, but now there's a variety of procedures and I don't quite know where I would fit, which I think would be vast majority of people at home. Now the very next thing that I would do is come in for a consultation. And you guys offer another service, which I know that you're in Nashville, but if someone perhaps is in Chattanooga who might want to come and thinks, it's a little far for me to get there, you can do some online stuff.
Yeah, we were the first center in North America to offer something called virtual consultations. You hear that word now, but 10 years ago we started doing this, and it's a great tool because even before Skype was around, patients would send us pictures of themselves, have us do an analysis of their hair loss, and we would do something called a webinar using a service called WebEx, where we can go in and show them some PowerPoint slides of patients with similar hair loss to their own, how that patient was before, how the patient is after the procedure they had done, whether it's surgery or non-surgery. And so we could use this tool, and it's great for patients that, as you said, live too far away, or maybe patients that live in town that are just too busy,
right?
Much like you. You know, you may say, hey, Michael, let me check out the virtual consultation option first. Let me kind of kick the tires to see what this is really all about. Let me narrow my options before I decide to drive to Brentwood to come in our office. Yeah, Brentwood's not far, but if you live in California, it's a haul, or if you're busy like you are, it's not convenient. So virtual consultations are a great way to find out what's best for you.
Now I know your consultations, be it virtual or in the office itself, are very in-depth. It doesn't take a long period of time, but talk about that process. So if I am someone who wants to come out to the Brentwood office and see you in person, what sort of time frame and what do we go through?
Okay, so the time frame can be 30 minutes to a little over an hour. One of the first things we do is something called video microscopy. We use a special video microscope to look at the person's hair on the sides and the back to determine how healthy that hair is. That's called donor hair if they have a transplant. But we use this tool mostly to determine the health of the hair on the top of the head. And then that helps us guide them as to the right choice for what they're looking to achieve. This scope has the ability to magnify the scalp up to 50 times, and that gives me and our medical team the ability to better tailor the treatment. Because a lot of times a patient may look in the mirror and think they're bald, when they may not in fact be bald. When the scope looks at their hair and they have thousands of little small vellus hairs that often can be revived with a non-surgical option. Laser therapy, PRP, those types of things. So it's a good tool. We're one of the few centers in the US that uses this tool. We think it's valuable, so we use it in pretty much most consultations.
And I think to that point, there's probably a lot of people at home who are thinking about this procedure. And I think just talking about it and getting into the office and seeing what your options are the best place to start, rather than think you've got this mountain to climb when things like PRP, which is a fantastic technology, may just be the answer. So relatively invasive. But if you guys want more information, of course, jump on to WeGrowHair.com. And you can also contact Michael Ramsey through that website, and he is very accommodating. So we will see you next time on Nashville Health and Wellness Program.